This segment of Delmarva Life is brought to you by the Delaware Health Information Network.
You don't need us to tell you that healthcare is changing, not just in the way that it's administered, but in the way the patient is involved in their healthcare.
Yeah, people seeking healthcare are not just patients, they're considered consumers, and that means they have choices. And in order for them to make those choices, one organization is making sure they and a network of healthcare providers are armed with information.
Delawareans know that good things come in small packages, so it's no surprise that our small state is making big strides in the movement of medical information.
You may have seen the ads on TV or the billboards on your drive to work. Delaware Health Information Network, or DHIN, is getting the word out about one of the most successful health information exchanges.
So you say, well, what does that mean?
Lakeisha Moore is the Director of Provider Relations at DHIN.
Really what it comes down to is it's a place where all of the different patients' records can be in one secure location for healthcare providers to access.
That means a safer and more effective delivery of medical care.
If you're down at the beach and let's say, unfortunately, you have an accident where, you think something happened to your leg, maybe you tripped over something and fell, and now, you're nervous that you got this broken leg or something's going on and you get rushed to the emergency room. But maybe your doctors are in the northern part of Delaware. Using the DHIN community health record, your doctor can actually log into the DHIN securely and access your records of anything that was done down in the emergency room when you're down at the beach.
It's important to us that no matter where a patient is, that that their care teams are armed with all the information possible in order to provide care when they need it.
Randy Farmer is the Chief Operating Officer at DHIN. He says soon those same medical records will be accessible by the patient. He says that access will allow patients to be better consumers of health care.
So they can make more informed decisions, have better outcomes from the care that they get, and hopefully cheaper, more affordable health care as a result of just being better consumers.
I think it makes them feel more empowered, and they're excited that they don't have to necessarily go and track down that information from a primary care or a specialist, or if you have multiple specialists, you can literally come to the DHIN Community Health Record and all your information is in one spot.
Delaware Health Information Network's roots reach back to 1997, when the Delaware General Assembly enacted the organization as a public-private partnership. 10 years later, DHIN went live, meaning it became the first operational statewide health information exchange in the nation.
We started with about 7 data centers back in 2007 when we launched, and now we're up to upwards of 26 major data centers, but now we also have private practices, or what we call ambulatory practices. Those are like your general practitioners, your primary care doctor. They're actually sending in what we call care summary documents. Those care summary documents are available in the DHIN Community Health Record for other specialists or others that may need access to that patient's information to see.
It helps tremendously knowing the patient's entire health record.
Dr. Anush Parikh is a radiologist at Mid-Delaware Imaging in Dover.
Before, we were limited to whatever the doctor's office provided us. But now, we can log on to the DHIN and get a history of the patient's entire medical record so that we can put it together with the imaging and say, okay, look, this was there before, so it's nothing. It's stable. It's nothing to worry about. Or I can say, this is new from a scan that was done in Wilmington or at the beach, and something to be concerned about.
As for security, in the 10 years since DHIN went live, it has built a consistent track record for the safe and secure delivery of records. Delaware Health Information Network is already saving money for the state and patients. A recent evaluation found the network reduced redundant ordering of high-cost radiology studies by 21% and lab tests by 64% over the course of 4 years. If you would like to read more about Delaware Health Information Network, go to our website, delmarvalife.com. It goes with what Dr. Harmon was saying, you know, just you are your own advocate when it comes to health.
You got to do it on your own.